Hello, I'm Sherry with the CGH Health Foundation, and welcome to our Growing Healthier program. In these programs, we provide education about important health topics and gives us the opportunity to introduce you to some of our very knowledgeable health professionals. Our programs are moderated by Dr. Bill Bird, and today Dr. Bird is going to be talking to Dr. Rafael Atassi, who is a new electrophysiologist with CGH, and Dr. Atassi is an expert in the way the heart works electrically, and he's going to be talking about what happens if our heart misfires and how we treat arrhythmias and other electrical issues with the heart. Before I turn it over to Dr. Bird, I want to just give you a quick update on what's happening with the Health Foundation. With the Health Foundation, we have many projects that we fund, and every year we highlight a few of those products with our annual campaign. And the title for this year's campaign is Your Kids, Our Cause. And so we're going to be focusing on some of our child-related programs, and those include things like our Eyeglasses for Kids program, the Prescott Dental Health Clinic, our CATCH program, which is a nutrition and physical activity we present in area schools, also the mental health services that we are funding in area schools. So all of those are a focus of our campaign this year. And so you know that when you donate to the Health Foundation, your money is staying local, first of all, and it's helping some very important causes and needs in our community. The Health Foundation has also been very active in the last couple of years in developing programs for our patients and their caregivers who have dementia, or patients who have dementia and their caregivers. And we've done things like establish dementia caregiver support groups in a lot of area communities. We have a dementia respite program, so a day a week where that patient can come and their caregiver can go and do some other things. We have those available, plus some monthly activities for people with dementia or just brain stimulating and brain health activities. And we took a big step forward with that, or the next step. Many people on our staff have become educated to be dementia friendly. I did it myself. And that was just having that awareness and, how can I help, and understanding the needs of the people that have dementia. And like I said, we took a step forward in working to create a dementia friendly community in Sterling. And we'll be doing more education and information on that in the future. But that's another thing that we've been up to. I just want to make a quick mention too that scholarship applications for our healthcare scholarships are due tomorrow. The Health Foundation funds 20 different scholarships. And so if you or a student who is working for a degree or certification in a healthcare related field, they can apply for one of those scholarships, but the deadline is tomorrow. Before I turn it over to Dr. Bird, let me tell you a little bit about next month's program. On Thursday, July 23rd, you can help us to meet and welcome our new neurologist, Dr. Brian Ansu, to CGH. Our program is called Inside Neurology, Understanding the Nervous System. And we'll learn about how neurologists diagnose and treat conditions affecting the brain and the spine and the nervous system, things like migraines and Parkinson's disease, seizures, stroke, etc. So again, that program is on Thursday, July 23rd, here on Facebook Live at noon. And now it's time to bring Dr. Bird on the screen so he can begin his discussion with Dr. Atassi. Are you ready, Dr. Bird?
Oh, I'm always ready, Sherry. Thank you very much for the intro. Welcome, everyone. This is Bill Bird, Chief Medical Officer at CGH Medical Center. Thanks for taking the time to listen in. And today's going to be an electrical day because we have our electrophysiologist, Dr. Atassi, with us today. Let's get Dr. Atassi here on the screen. There he is. Dr. Atassi, welcome.
Thank you very much.
I don't see an arm twisted behind your back, so thank you for showing up and taking some time to answer a few questions for us.
Absolutely. Absolutely.
Dr. Atassi, we're really excited. Dr. Atassi just recently started here at CGH as one of our electrophysiologists, and the really nice thing about Dr. Atassi and what we're able to offer now with Dr. Atassi is he's here all the time. So he's full-time So even this week, we were talking before we went on that he's been around and been able to do several pacemakers for patients that needed them. And
Yes.
I'm really excited about that for the hospital and for our patients. So Dr. Atassi, you ready to answer a few questions for the folks that are watching?
Yes, I am.
All right. Let's start by just telling us a little bit about yourself.
Okay. I was born in Syria and went to medical school in Cairo, Egypt, and came into the States immediately after that, did my training in general medicine and then in cardiology fellowship and then cardiac electrophysiology fellowship. And then I've been in practice basically most of the time in Cleveland, Ohio, but in different parts of the country too. I started practicing electrophysiology more than 25 years ago, and that's what I've been doing since then.
Tell us a little bit about to become an electrophysiologist. What does the training look like?
You have to have a basic training in general medicine, which is usually 3 years of general medicine. You rotate in different specialties of medicine. Then after that, you apply for the cardiology fellowship, where you do spend 2 years of general cardiology training. You get exposed to varieties of cardiac diseases and specialties. And then 2 years after that, you do training in electrophysiology. So it takes 7 years of training to become an electrophysiologist.
Okay. Yeah. I just want folks to get a sense of your knowledge base as you walk in to help us out here at CGH. So, and just for folks who are watching, this is my simple way of looking at our hearts. There's a plumbing system.
Mm-hmm.
Yeah, which is your valves and the pump and the blood vessels, and then there's an electrical system, and that's what Dr. Atassi is. That's his specialty, is the electrical part of your heart when it's not working well.
Yes, we are the electricians.
Yes, you're the electricians. So let's talk electricity. First one I wanted to talk about is, from my perspective, one of the most common electrophysiology problems, and that's something called atrial fibrillation.
Yes, sure.
What is it? What's atrial fibrillation? Define it for us, and then what's your approach to treating patients who have atrial fibrillation, Dr. Atassi?
Sure. A normal heart has one beat in the upper chamber that gets conducted through the specialized conduction system, the specialized electrical system of the heart, to the lower chamber. And a normal electrical impulse, normal heartbeat, explains why this valve closes at this point while the other valve is opened, and make sure that the blood flows from one chamber to the other to continue and finish the cycle. In atrial fibrillation, the left upper chamber gets, for certain diseases and pathologies, suddenly the heart rate goes like 500-600 beats per minute, very chaotic and irregular, whereas a normal heartbeat is one beat in the upper chamber followed by one beat in the lower chamber. And it's usually around 60-70 beats per minute if we're sitting doing nothing. If we start exercising, emotional, whatever, the heart rate appropriately goes up and down. Whereas in atrial fibrillation, the upper chamber is going 500-600 beats per minute. The lower chamber is irregular. It doesn't go that fast because we have a safety mechanism that does not allow the 500-600 beats from the upper chamber to get conducted to the lower chamber, which is a very good valve. But the irregularity, and the rate, the upper chamber loses its function as a pump. It becomes only a reservoir for blood, and the blood moves from one chamber to the other by gravity, and that affects the heart, the general heart functions, ends up with dilatation of the upper chambers, followed by dilatation in the lower chambers, a condition called heart failure if it's not taken care of. Also, atrial fibrillation is notorious to causes people to be at risk of having strokes and blood clots. It's one of the most common causes of strokes in the United States for sure. So although most of the time or frequently it's asymptomatic, but still it could create, if untreated, it could create issues in the future. We just mentioned strokes, heart failure, and symptoms. Although the patient might tell you, I don't have symptoms, but in reality, if you look carefully, they are symptomatic.
Okay, and I know that there's medicines you can give folks for that. And to help with the atrial fibrillation. Obviously, patients come in the hospital. Oftentimes, we give them medicines to control that and to slow it down and hope to put them back into sinus rhythm.
Yes.
It's not uncommon for you to do something called cardioversion for patients. So you basically shock their heart back into the regular rhythm. Another option that I know that you're skilled at is something called ablation, cardiac ablation. I kind of like to focus in on that because it is something that, as an electrophysiologist, can be really helpful for patients who have these circulating electrical abnormalities going on in that top left chamber of a patient's heart. Can you talk a little bit about the ablation procedure process? Who's a good candidate for it? And maybe even talk a little bit about the pulsed ablation process that you're going to be doing here at CGH.
Sure. Atrial fibrillation, like we said, it's chaotic rhythm, very irregular. The triggers for the atrial fibrillation are those pulmonary veins that they bring the blood from the lungs to the left upper chamber. They start the atrial fibrillation. And the basic way of treating with ablation is to go and zap the areas where those veins meet the left upper chamber. This is the procedure we call ablation. So we basically create a small scars at the opening of those pulmonary veins to the left upper chamber. By creating the scars, the impulses that irritates the left upper chamber will stop and not cause the atrial fibrillation anymore. It's invasive procedure. It's picking up significantly. It's approved now to be first-line treatment for the right patients. There is basically 3 different sources of energy one can use to treat atrial fibrillation. One is the oldest one of them, called radiofrequency. Then there is the freezing protocol, the cryotherapy, and the most recent is the PFA, where we basically, this is a system that creates fields of electricity that damages the cells that we want to damage, the cells that we want to create scar, and avoid damaging other structures in the heart or in the structures around the heart. And this has been available now for 2 to 3 years with significant success rate, at least equivalent to the rest established therapies for atrial fibrillation, if not more. Definitely safer, less complications, and it takes shorter time. So the patient in the past used to be, while we're doing the procedure, it used to be 6-7 hours. Now it's down to about an hour or so. And the patient goes home the same day. It's done under general anesthesia. The patient comes in the morning, have the procedure done. 3-4 hours later, he's back home. So it's promising a lot, and we're fortunate to have it now here in our community in Sterling. The system is available. We have been setting up the system now, and we're waiting to start our first patient soon. And I do think it's going to make a lot of improvement in the patient quality of life, and reduces complications from the procedure itself and from the atrial fibrillation itself. Yeah. Atrial fibrillation is a chronic disease. It's not frequently curable. It's like treating diabetes, high blood pressure, high cholesterol. You try with different modalities of treatment. You try to control the condition, not necessarily cure it. But it's promising. This PFA is promising, and everybody is switching to it now. and we're very hopeful and very excited about having it here in the community.
Yeah, for sure. For sure. Yeah, it's just it's interesting thing how you and your team map the atrium, like where the abnormal electrical impulses are coming from, and then this software, this equipment helps you to pinpoint those, and then, as you say, zap, but some sort of electrical charge to take care of that. So very cool.
It reduces the duration of the procedure significantly. We used to be in the lab for hours. Now, definitely from the beginning till the end, it's an hour or about, and the patient goes home the same day.
Besides atrial fibrillation, are there any other arrhythmias, abnormal electrical impulses in a patient's heart that you would treat with this ablation process?
Yeah, with ablations in general, we treat a lot of varieties of arrhythmias. There are different types of fast heartbeat, upper chamber fast heartbeat. We call them supraventricular tachycardias. And yes, we can ablate them with significant success rate and cure for the condition. We can cure, patients with SVT. There is also premature contractions, like what the average person would call skip heartbeats.
Mm-hmm.
They're from the upper chamber, from the lower chambers. There is a more serious arrhythmia that comes from the lower chamber, the ventricle, called ventricular tachycardia. We can certain types of those ventricular tachycardias. We can also ablate what we call, the average person will call zap. We zap those tachycardias. So, arrhythmias that need to be treated with ablation are very common, absolutely very common. And, we can make a significant impact on patients' quality of life. We can cure a lot of their symptoms. Not everything, but a lot of the arrhythmias can be cured by the ablation protocols.
Yeah. I want to switch gears a little bit with you and talk about something else that's pretty common in electrophysiology, pacemakers. So talk to us a little bit about what are some of the common reasons that you would need to put a pacemaker into a patient, and how that process works, and what kind of pacemaker you decided to have to give to the patient.
Sure. Pacemakers are also known batteries, like the batteries of the heart. Basically, in a simple explanation, it's like a timer. The patients usually needs pacemaker most of the time because their heart rate slows down. Either all the time it's slow, or sometimes all of a sudden the heart stops for a few seconds. And patients don't like this. They faint, they have frequently they feel tired, fatigued. So the pacemaker, when we implant them, we basically guarantee for the patients a heart rate, let's say no less than 1 beat per second. That means a heart rate of 60 beats per second. So the pacemaker sits and waits. If the heart itself makes this beat on its own, the pacemaker will stop and do nothing, only observe. If that second passes by and the patient still has not had a beat of his own, the pacemaker will intervene and pace at that point. So that's the initial type of pacemakers. We treat arrhythmias called bradycardia, which is a heart that is very slow, totally different from the other types of arrhythmias where the heart goes very fast. There is single lead pacemaker. There is dual chamber pacemakers. There is now 3 wires type of pacemakers. There is pacemakers that now the more advanced ways of pacing is we still try to use the patient's electrical conduction system itself to pace those electrical system rather than pace the upper chamber or the lower chamber, which provides more physiologic pacing for the patients, and the patient feels much better. Pacemaker has been around for 60 years or more, and a lot of patients requires pacemaker, and sometimes they live the rest of their life with pacemakers.
Yeah. You and I were taking care of someone this week, and that patient felt so much better
Yes, you're
after
right.
they received that pacemaker, and their heart rate went up, from the 40s to the 60s or 70s.
Absolutely, yes.
Blood's a nice thing to have flowing through your body, right?
Yes, absolutely. He told me I have not felt this way in years. So
Yeah,
I don't know when he started having the problem.
yeah, for sure. Uh, and then one of the other tag-ons to pacemakers that I know you sometimes will help put into patients, and it's called a defibrillator.
Right.
Talk a little bit about that and what patients you also put defibrillators into to help them out.
Sure. Defibrillators were initially indicated for ugly rhythm problem, the people that they have cardiac arrest, suddenly out of nowhere, the patient collapses and, they pass out. And, when the squad arrives, they find him in an ugly lower chamber rhythm called ventricular fibrillation or ventricular tachycardia. So the first indicated defibrillators were basically for those patients. And from that point on, and they were approved, I think, in 1984, 85,
Okay.
but, very primitive. Nowadays, they have improved significantly. And we don't wait now till the cardiac arrest happens. There are patients whom we think they're at risk of having that ugly rhythm problem. So we go and implant the defibrillator, which is basically a shocking device, a pacemaker combination with shocking device. It's monitoring the heart all the time. If and when the heart goes ugly fast, it's only at that time that the device will go and shock the heart back into the regular rhythm. Then we added a few things, technology added a few things to the defibrillators. They are excellent, very sophisticated pacemakers built in at the same time with a defibrillator. Most of today's patients that they have a defibrillator, they have very sophisticated pacemaker too. And, it prolongs life for sure. And, it saves lives and it provides a very good therapy. Like I said, we started implanting defibrillators after the event of cardiac arrest. Now we try to avoid cardiac arrest by identifying patients whom they're at risk. And early on in their life, we advise them that you need a defibrillator. It does not mean that everybody who gets a defibrillator will get shocked, but at least it's like an insurance policy. If you need it, it's there.
Yeah, seems to me like patients that most commonly get are the folks who come to the hospital and we find that their heart isn't pumping real well.
Exactly.
And that seemed for a non-electrician, for whatever reason, that seems like it throws off the electrical circuits in the heart. And so those are the patients that if we give them medicines and it doesn't seem to help the heart pump better, that those people essentially get an AED in their chest.
Right.
Which, like if you're around town and you see these AEDs in different places, defibrillators is a fancy version of that Dr. Atassi puts inside of you.
What I tell patients, I will tell them, you will have your squad with you all day long, night, day, wherever you are, whatever you're doing, you have your squad with you. Whenever you need it, it's going to be there. And it does work.
Yeah, for sure. Okay. I think that's the main stuff I wanted to cover with you, Dr. Atassi. I think that very helpful for folks to hear some of these things. Once again, Dr. Atassi is seeing patients here in Sterling in his clinic, as well as, thank you, as well as doing procedures here at the hospital in Sterling for patients who need electrophysiology help. We also have Danelle Saunders, who's a nurse practitioner who's seeing patients. And then Dr. Olshansky is here, not as often, but at least once or twice a month to see patients as well to help people out.
Sure.
So we have some good electricians here at the hospital, and wanted to make sure you got a chance to meet Dr. Atassi. So Dr. Atassi, thank you so much for your time. And your pager went off when we were talking, so I'll let you get back at it. I'm sure you have patience.
Thanks, Dr. Bird. Thank you very much. I appreciate it.
All right. And as always, as you watch this and find it helpful, please share this with others who you think might be interested in learning more about all things electrophysiology. Okay. So, hey, I wanted to give a shout out to a few folks. Heather Pear. Heather is a central supply technician here at CGH, and she was our May Employee of the Month. And our June Employee of the Month is Jennifer Jelricks. Jennifer works in the cardiac cath lab area. When you walk by that department, Jennifer is going to be there and saying hi to you. So congratulations to Jennifer on that award. Speaking of awards, Daisy Award, most recent recipient is Jennifer Bookman, who is the nurse at our CGH Polo Clinic. And just to wrap things up, just a reminder that next month, Dr. Ann Sue, who is a neurologist who is going to be based here in Sterling, and he's here full-time seeing patients and taking care of people with neurological problems. We will be having him on next month to talk about the nervous system. So looking forward to that conversation with Dr. Ann Sue. Okay, well, thank you so much for taking the time to watching this episode. This is Bill Bird, Chief Medical Officer at CGH Medical Center. Thanks for watching, and we'll see you in a month.